lot of women around this time in their life where they're starting to realize that they have stubborn weight loss. They're starting to get a little bit of abdominal adiposity, that weight around their waist circumference that they weren't used to having. And they're starting to see a lot of changes in their body. And this is a real big sign that we need to be more proactive than ever to reduce the risk of cardiovascular disease in this subgroup of the population. Estrogen can help with keeping the arteries elastic, and when we have a decline in estrogen, it can make our arteries more stiff, which can also lead to hypertension and vascular issues when it comes to heart health. I'm Michelle Routhenstein. I'm a registered dietitian who specializes in heart disease management and prevention through science-based nutrition. A lot of my practice are really geared towards women and in the perimenopause and menopause arena and time frame, because their risk of heart disease kind of surfaces at that point. So whether they have a family history, whether they have a high lipoprotein A level, it usually can surface in terms of cardiometabolic disease around the time of perimenopause or menopause, or in some individuals in early menopause. And this is particularly because estrogen levels decrease, and estrogen is very protective for women. And as that lowers, we see a lot of differences in terms of body composition, hormonal changes, and direct impact on the arterial health. When you have high blood pressure that's not controlled, so if your blood pressure is above 120/80 or above 110/70, there's a lot of things that are going in your body doing silently. Your body's overcompensating. And then over 5 years, 10 years, what ends up happening is you can have a cardiovascular issue. So let me walk through with you how it impacts really essentially all organs of our body. And I'll try to make this short because it really does have a big impact on a lot of things. So one thing is high blood pressure can cause that constriction in the arteries, which can lead to potential blood clots and ruptures and stroke. It's the leading cause of stroke. It can cause AFib, atrial fibrillation, which is an irregular heartbeat that leads to blood clots and increases your risk of stroke as well. It can also lead to heart failure and aortic root dilation and aortic root aneurysms. What that means is when your heart has so much pressure build up, it's constantly pumping all of that blood throughout the body, the heart has to overwork and it can get enlarged. And after a while, it can't do its job efficiently anymore. So instead of pumping oxygenated blood throughout the body, it's unable to do that. And it can lead to swelling. It can lead to fluid buildup in the lungs. It can lead to heart failure that can progress and cause within 5 years if it's not addressed. High blood pressure is not something to ignore. And it also can impact all aspects of heart health. So it affects the actual heart muscle, but it affects also our blood vessels. It can cause a tear in the arterial wall, leading to more plaque and fatty substances, which leads to blockages and narrowness of our heart as well. We must address it. And when we do address it, we can reduce all of these issues. High blood pressure also can lead to Alzheimer's disease, dementia, kidney failure. It leads to so many different aspects of our overall health and our longevity. So it needs to be monitored at home and it needs to be intervened to optimize it. We don't want to ignore this really important measure. It's called the silent killer because you don't feel it oftentimes unless it's very high. So make sure that you know your numbers and you're intervening as soon as possible. You may wonder, what is insulin resistance? Insulin resistance is when your pancreas is overpumping insulin in order to help put blood sugar into the cell. It's struggling. It's having a hard time with glucose management, so it's overcompensating. And so if you are insulin resistant, your blood sugar levels might be normal on a blood test. Your hemoglobin A1C, the 3-month average of your blood sugar levels, may be normal on a blood test because your body's overdoing the work. So you can be insulin resistant for 5 to 10 years before diabetes or prediabetes surfaces or a high blood sugar level surfaces. So insulin resistance is before it happens. And we see that 70 to 80% of people who have heart attacks are insulin resistant. And so some signs of this could be high triglyceride levels. It can be a diagnosis of fatty liver disease. It can be that stubborn abdominal weight. And so we want to address it, whether we have those symptoms or we don't. And we want to help the body produce enough insulin, have our cells be more insulin sensitive so that it can uptake that blood sugar. And so the blood sugar goes where it belongs and not in the bloodstream where it can wreak havoc and cause vascular issues. It's super important that we address it. And you might think, okay, well, you just mentioned blood sugar several times. So if I get rid of all carbohydrates, all sugars in my diet, that's going to be the solution. And it actually isn't. And the reason why is because if you tell your body, hey, I'm taking all this carbs out, it's going to say, okay, now I can process this easier. Maybe your insulin levels will come down because you're not making your body use the insulin. You're just telling your body, I'm just going to remove the problem. You're putting a Band-Aid on it versus solving it. Instead, I want you to add carbohydrates because they're very cardioprotective, but I want you to do it in the right balance so that we're allowing your body to utilize the insulin more effectively. So for instance, if you're going to have a fruit like an apple, I want you to pair it with about 10 walnuts or 10 nuts or seeds or 10 nuts and then, a tablespoon of seeds, because that is going to help slow down the release of blood sugar from the food and allow insulin to do its job more effectively. There are also some foods that cause insulin resistance, like foods high in saturated fat, that we need to reduce in your diet as well. So we need to teach your body how to process insulin and blood sugar. We don't want to remove carbohydrates because that's not going to help it. The next time you have a carb after you do that for a couple months, your body doesn't know how to process it, and then we get into trouble. If we teach your body how to process blood sugar well, then you can get the nutrients from those foods and you can combat insulin resistance. And that's important. So food pairing and balancing is vital and something I spend a lot of time with my clients so they can master, because it helps with insulin resistance, but it also helps with the absorption of many nutrients that are in our food. When you think about inflammation, you can almost think about when you get a cut on your hand and all of a sudden you see like it's red, it's swelled up, and that's when you think about inflammation. That's what the body does to protect ourselves in terms of an immune response, in terms of what we're trying to do to heal. When you have a cold, when you have a virus, there's going to be acute inflammation. It's your body's natural way to respond, and we want that to happen. The issue is when we have underlying chronic inflammation that really wreaks havoc on all symptoms of our body. Just like I mentioned immune health, just like if you get sick, if you have low-grade inflammation, and then you get sick, your body now has to work double hard to help actually combat that inflammation, which is why when we had our pandemic, you saw a lot of people who had underlying issues respond to COVID very more severely than someone who didn't have any heart issues or any issues because of that underlying inflammation. So when it comes to women in midlife, I want you to really understand one of the risk factors for that inflammation and how it's brewing. So when you have that change in body fat distribution, when you have that abdominal weight, that's a very active abdominal weight. What that means is there's a lot of pro-inflammatory cytokines or proteins that are shooting out from this adipose tissue. Because it's centralized around your visceral organs, it's very metabolically active. And that causes a lot of underlying inflammation because of the nature of where it is, which is why checking your waist circumference and really being mindful of this change is important, and we want to address it. When you think about what inflammation does, so when there's inflammation in the body, that causes more plaque to form. That causes that plaque that's there that you may not know is there to be more susceptible to break off, to cause a blood clot, to lead to a heart attack and stroke, which is why the risk of heart attacks and strokes rise tremendously around menopause when we have this shift in where the weight is located in the body. So it's important that we tackle it and that we address that inflammation so that we can address heart health. We can address really all issues of all chronic disease. When there's inflammation in the body, it's more susceptible to cancer, to heart disease, to diabetes, to metabolic syndrome, to autoimmune diseases that may pop up later in life too. So it's important that we are addressing it and really making sure we're aware of how that looks like. You can also test your inflammatory markers. So waist circumference is good because you can do it in your own home. But if you're going to get your physical, like I mentioned earlier, I want to make sure that you are also asking to get HSCRP tested. So it's a high sensitivity C reactive protein. It's an inflammatory marker that is sensitive to detect underlying inflammation. Certain labs will call it cardio CRP. That's the same. You just want to make sure that it's highly sensitive so it picks up any of that underlying inflammation that we want to address. And ideally, you want that number to be less than 1 milligram per deciliter. There's a chart where it kind of grades it, and it says, moderate risk is in a certain range, high risk is above 3. And so I want to make sure that you're in that lower risk category to really combat any issues when it comes to heart health.